Hello, I'm Bill Santamore, Managing Editor of Hospitals and Health Networks magazine. I'm here today with Maulik Joshi, President of the Health Research and Educational Trust and Senior Vice President of Research for the American Hospital Association. We're going to talk about the AHA's HPOE project, or Hospitals in Pursuit of Excellence. HPOE provides tools and resources to help hospitals improve performance and meet the challenges of healthcare reform. Thanks for talking to me today.
Thank you very much for the opportunity, Bill.
First of all, can you give me a brief description of what HPOE is?
HPOE, or Hospitals in Pursuit of Excellence, is the American Hospital Association's strategic platform to accelerate performance improvement throughout all our hospitals and to support health reform implementation. By working with all our hospitals and sharing best practices, providing tools, providing leadership development opportunities, and through working together on national projects, we're really seeking to really accelerate improvement through all our hospitals.
Okay, what are the main strategies for doing that?
Sure. HPOE has 4 major strategies to accomplish our goals. The first is around education. The great part of all our hospitals today in our country is that we are making tremendous improvement across every clinical area we can think of. So HPOE's education strategy is to share best practices. We want to identify the best practices that are out there and share them as broadly as possible with our community. So through our hpoe.org website, we have case studies, we have webinars, and we have other vehicles to engage all our peers in terms of accelerating improvement and sharing their knowledge and best practices. The second strategy is around tools and guides. Through all parts of the American Hospital Association, we have developed great guides, tools, how-tos on specific topics that are relevant to the hospital community and their leaders. So topics such as how to reduce avoidable readmissions, how to achieve high performance in health systems, how to use workforce practices to drive quality improvement. These are all examples of guides that we have produced and are available on our website for others to learn from. The third strategy is around leadership development. For the 9th year, the American Hospital Association, in partnership with the National Patient Safety Foundation, has a Patient Safety Fellowship program. And this year in July, we have another 30-plus individuals starting that fellowship program, a year-long intense program to learn from each other on the science of patient safety and implement actions back at home. We're also looking to develop a second fellowship or network program for individuals interested on health reform implementation. So leadership development is a key piece. And the fourth piece is national projects. The Health Research and Educational Trust is a contractor from the Agency for Healthcare Research and Quality and is working on some major projects to eliminate infections. So right now we're working on 2 areas: central line associated bloodstream infections and reducing catheter associated urinary tract infections. So those 4 strategies are our main vehicles to accelerate improvement and support health reform implementation: education, tools and guides, leadership development, and national projects.
Can you tell me more about how this fits in with health reform?
Certainly. Health reform is really reform that gives us hospitals the opportunity to really transform delivery and payment issues. So HPOE's main goal about accelerating improvement is the foundation for health reform. Health reform issues such as bundling payment, accountable care organizations, value-based purchasing, all are based upon some core fundamentals, which is performance improvement. So as strong as we are in HPOE, as strong as all our hospitals are in core performance issues, that's our foundation to build upon our delivery and payment reform.
Can you speak more about the strategy of developing these tools?
Sure. The great part about what we're trying to do is really leverage a couple of areas. One is leverage what's working in the field. So we're not looking to create brand new knowledge. We're looking to leverage what's already being done out there. So that forces us very well to work with national and local partners, working with our state hospital associations, working with Premier, VHI, and the other national organizations that are really developing outstanding work in this area. So how do we leverage that known evidence and build it out there? The second part is we are working on areas or research projects where we can generate some new evidence. So the Health Research and Educational Trust, HRAT, is working on research grants and contracts that allow us to identify great practices, review the literature, and produce guides. And so we are really leveraging what's out there and then developing areas where there's a need or a gap that we can find some evidence.
How have organizations used these guides?
Sure, it's actually quite great. First of all, we know a lot of people are downloading these guides. So we've had thousands of guides downloaded. And I think obviously that doesn't change behavior, but it's one measure of uptake. People are actually reading these. We've heard countless stories from organizations and how they use these guides. First, they've shared them with their boards. So I know of one health system board that has used our guide specifically, shared it to every board member and asked, how do we match up to what the best practices are associated in this guide? In some of our other guides, like readmissions, they've shared it amongst their staff, specific around their improvement project that they're working on. We've surveyed the field in terms of those who've downloaded the guides and said, how are you using them? And it's been sharing, identifying best practices, connecting with others in the field in terms of what they're doing. So I think they're really providing not just a resource, but a stimulus to really work towards making some incredible action to improvement.
What is the HPOE implementation roadmap that will be released at the AHA Health Forum Summit in July?
Yeah, we are very excited with our HPOE implementation roadmap. We have now, throughout the year, produced a number of great guides or tools, starting in leadership, in disparities, in clinical areas, workforce areas, and in emerging areas like bundled payments and ACOs. So what we're doing is actually putting together a compendium. We're putting together our top 10 guides, so to speak, and putting them together in a binder that we're going to have available to every attendee at the AHA Health Forum Leadership Summit. So this 200-plus page document will have the guides, and they'll be organized by major strategies. So we're not just saying, here are 10 great ways to do things. When you're going to work on leadership, here's a terrific resource from the Center for Healthcare Governance, from their Blue Ribbon Panel report on competencies of governance. If you're working on disparities, here's a terrific way to think about how do you collect that data using the HRET Disparities Toolkit. If you're starting to think about bundled payments and ACOs, here are the research synthesis reports on bundled payments and ACOs. So we're trying to take what we've developed, but put it together so, again, a healthcare leader can look at the broad picture of reform implementation and improvement and know where to start and where to look.
What new guides can hospital leaders expect to see in the second half of the year?
Sure. We're really excited. Again, we're trying to continue our path of producing information that's really valuable and relevant to leaders today, not just because of improvement, not just because of implementation, but because of what they're doing for their patients every day. So a couple of new guides coming down the road. We are actually going to be producing one on how hospitals are using the data they're collecting on race, ethnicity, and primary language data to reduce disparities in their own hospitals. So a guide on, again, how they're using this data, I think will be very valuable to the field. We're developing another guide on a prevention toolkit for catheter-associated urinary tract infections. We're developing another guide on the use and access of capital for hospitals as we think about the future. So again, we're trying to focus the guides on diverse areas, but yet focused around the core performance areas of hospitals in pursuit of excellence, which serve as the foundation for supporting health reform implementation.
Okay, and again, the HPOE website is?
HPOE.org has a number of case studies and news stories and other ways to engage.
And it's constantly growing?
Constantly growing every day in terms of linking to other individuals and organizations.
Okay. Well, thank you, Maulik. I appreciate your talking to me today.
Thank you very much for the opportunity and look forward to working with you and all the hospitals.